of district collector. So Mission Kotla was started in last January 22 as the district collector joined here, and he realized that there are several issues or the media news were there in news channels and newspapers, and there was a negative feedback about the district Kotla related to various socio-economic problems. Uh, um, these are some news clippings are here, or the social evils were also there, like Motana, Jungle Jalao, and additional. Apart from this, there was social issues, demographic issues were there. The Kotra district block is about 150 kilometers dense forest area, and the second one is it's a highly ST populated area. So there are lots of problem related to the service delivery. Especially the district collector visited the block Kotla, and he realized that the Kotla is far poor condition due to the demography, due to the culture and other things. So he started his mission Kotla from the day he joined here as district collector. The basic statistics of the Kotla was very pathetic situation. 95.82% population was tribal, 120 kilometers away from the district headquarters. Most of the posts in government institutions were vacant at the time. Next is the main issue was with the tribal people was that they hesitate for their rights. They do not know what the schemes their beneficiaries are. Are they getting the benefits or not? Are they included in the schemes or not? Because most of the schemes after 2015 were based on the Vamasha or Janadhar card. So it was very difficult for them, because due to the network, there were network issues also. There were the schemes were on digital platforms. So due to poor literacy, the literacy, especially in case of women literacy, was very poor. According to 2011 census, it was only 16 to 17%. So these are the major issues. Apart from this, lack of livelihood opportunity was there. There are lots of SSGs were formulated in Rajivika mission, but they were not active, and there was a need to mobilize them and for the skill trainings. And last one is unique social practices like Motana, Jungle Jala, or Chalotra and Ved. These were the main issues were addressed by the in Mission Kotra by district administration. And the stockholders were mainly the NGOs, the officials, administrative officers, and general public. These were the several meetings were conducted with the district administration, district level officers and block level officers, political leaders and NGOs at the block Kotla. And all these issues were discussed. What are the main reasons why the service delivery is very poor? These issues were discussed, and then a roadmap was prepared, a thorough roadmap was prepared. Various camps were organized at different areas based on the survey and the gap analysis and the secondary data available on Mission Antyodaya and SECC data. These are the some status before and after. You can see that the major schemes or of the Social Security Department was very in pathetic situation. Only in Palanhar pension, the registration increased to about 2 or 3 times in various government schemes. And these are the results of up to March 2023. Within a year, the progress was done in various social security schemes. In industrial area was also sanctioned, as the migration rate was very high at Kotra block, and the major road connectivity issues was resolved in last 1 year. There is a 50-kilometer road from Devla to Kotra was sanctioned and completed for the that provided the communication easy, and for the marketed the products produced at the block level. 10 dairy booths were allotted for stadium sports activities. 11 stadiums were sanctioned and completed. One Krishi Upaj Mandi, which was inactive at the time, was operationalized, and the network issue of connectivity, because the major services of the government was through the e-mitras and through the GEM portal or the Aadhaar and Janadhar. That's why, and 103 mobile towers were sanctioned, and the network connectivity was provided through the Gujarat network. These were the major steps taken. The approach or the uniqueness of the mission was that, first of all, there was nothing new in there. The most important thing was that there was a missing gap between the what is the schemes provided by the government at the district level, and it is not percolated to the grassroots level through the gram panchayat and village level. So the headquarter was shifted from the district to the block level. Various meetings were organized there at the block level with the district level officers, block level officers, and the political leaders. So this was the main uniqueness of this project was, and this was done regularly on regular basis within 15 or 15 months or 15 days or a monthly basis, on the monthly basis. The From district level, one nodal officer of the rank of chief executive officer was deputed there for this implementation of the mission, chief executive officer. They organized the camps based on the gap analysis of the beneficiaries. There was Samvad program was also conducted with the NGOs, and effective implementation was reviewed time to time. For the sustainability of the project, 2 buses were allotted to the block Kotra, Gatiman Prashashan buses, because this registration and the gap is a continuous process, because for the pension scheme, for the Palanhar schemes, the beneficiaries are not static. The numbers always changes according to their eligibility. So 2 buses are there for, and the camps are regularly organized there for the registrations. So one time it was noted that as the public gets aware through the these camps that they are the beneficiary of the schemes, and they get benefits directly because of the DBT schemes. When they get benefits, they know that they know their rights, and they get enlightened for the schemes, and they spread this message to the other persons. For this, self-help groups were also mobilized, and various schemes were that were included in the projects are listed in the column 3, standing of the schemes. These are the main novel points were targeted. First is that the Adivasi Mahotsav was organized, and as it was listed as in a calendar year, so that to show off the Kotra and the speciality of the culture, special culture was addressed here. Second one is that the exposure to the sports persons of the, especially to the women, was given of the Kotra sports person. As I told, 11 sports stadium was sanctioned in Kotra block. So this was the second one. Next is these are the major achievements we achieved in 3 fronts. First is infrastructure, social security, and the socio-economic benefits. And infrastructure, as I told, that the road sanction, network connectivity, buses, RO facilities to the schools, GSS was sanctioned, Upaj Mandi was operationalized, RICO industrial area, stadium, dairy, booths, and library. In social security level, major schemes were identified and addressed. Right now, I am in a position to say that in most of the social security schemes, we are at a saturation level, because lots of camps were organized, and the surveys was done, and now the people are linked with the social security schemes, those who are eligible for the schemes, and they are now aware about the schemes and the benefits given. The dropout rate was decreased to 12%. After the survey, the enrollment increased to 12%, sorry. And the registration of pregnant women also increased, institutional delivery increased, and vaccination was also increased due to the awareness. So next is the socio-economic benefits. There were lots of socio-economic benefits we have listed out. The most important thing is that the art and culture and the artists of the local area were promoted. Their performance was, they have given a platform at the G20 international level programs at district level. And they as I told, that Adi Mahotsav was listed in the calendar for yearly program, and celebrated the district level program at Kotla on the Vishwa Adi Devasi Divas and Kabir Yatra. These are some news clippings are there. And for replicability, this model is easily replicable, as there is no additional budget is required, no additional workforce is required. All the schemes which are already in the government departments, just implement it. It's the way this mission provides the way how to implement, or how to include the beneficiaries through the schemes, and the benefits are transferred. This is the major or how to involve the community, which is to the mainstreams. These are the main highlights, or the main motto of the mission, and which was we can say that have achieved so far. So this model is sustainable, and then in the coming next, after 2 or 3 months, we realized that the mission is going well. So we expanded this mission to the other 2 or 3 blocks like Lasaria, Jadol, and Falasia. And on the same line we worked there. And we can say that there was also the increment in the, or the improvement in the indicators, major indicators. These are some pictures. Road connectivity and the benefits transfer to the people, and tricycles distributed. These are some works that are in progress. Matsya Sakhi program, 5 women producer groups of formed, and 2 lakhs given to each for the fish farming. And Garbhavati Sar Sambhal Abhiyan is also started. Medical camps or ultrasound machines have been arranged through CSR, and weekly date will be set to check up for the women for the malnutrition, because malnutrition rate will also decrease in the area because of the medical camps. Smart TV for the senior secondary school, because there is a lack of lots of vacancies in schools level. So the smart TVs were also distributed to the schools level and for the panchayat fund. This mission was also awarded at the state level to the district collector on the Civil Service Day 2023. These are some clippings. This is Herbal Gulal, one district, one product. Herbal Gulal is produced in the tribal area of especially the Kottara district, and especially the product is very unique, and it's demanded throughout India from the various departments, and it is available or supplied throughout the India. This is all from my side. Should I start the one video, sir, for 1 minute?
No. Let's finish with this, and after that we can have the video. Thank you. A lot of effort has gone into this project.
Yes.
And you have achieved fair amount of good outcome. And you have also looked into the sustainability of the project on the long-term basis.
Yes, sir.
My only addition to the excellent job that you have been doing is keep on monitoring the key objectives, the impact and the outcome, and try to bring about a system which will take the learnings from the impacts and outcome, see, it's not only what well is achieved, but also where the improvements are possible, where the things have not gone as what it should have gone. So how you can keep on improving and evolving the project over a period of time. Because the most important thing what comes up, that the environmental changes, educational changes, societal changes keep on taking place over a period of time. So whatever your initiatives are, they have to get aligned to the new environmental rules which are there. So it is inevitable, because we
Yes,
may
sir.
say it's difficult to change, but change is inevitable and things keep changing. So the project also has to realign itself and be flexible enough to realign to the new needs and requirements for the future.
So I
So
think that once the public is aware about their rights, because unless and until they are aware about what the schemes they are eligible to, and how to register themselves,
so the
and yeah,
awareness is extremely important.
yes.
Now, if
So
today the awareness is to the 60%, the situation will change when the awareness becomes 80%.
yes,
Because
yes,
it's not only being aware of the project or aware of the benefits, but when they become aware of the benefit, they would also come up and ask some changes and modification as to what in the scheme itself requires to be modified or requires to be addressed to meet the new challenges. So that is what is
because the picture of the quota is now changing very
very fast.
fastly. The retention rate of the officials has improved, and at the school level, the enrollment has improved. That I think that this will change in the near future, sir.
That's right. That's right. That's right. Okay. Thank you. Thank you.
Thank you. Thanks.
Yeah, excellent achievement you have made. You have looked into many aspects, because basically what you rightly said, that this is convergence of all existing schemes. You are not asking for more manpower or anything like that.
Yes, sir.
So with the existing one you are doing, so naturally it is
Yes.
sustainable. But as Bhushanji has
Yes,
said,
sir.
you have to actually work out a procedure for future, because what you have done today is good, but maybe after the awareness increases, it will not be good enough for them. They will start demanding more from you, because
Ma'am, yes, sir. Yes, sir. Yes, I would like to add, ma'am, that for the sustainability of this project, the government of India, Niti Aayog, has started the aspirational block program, and the mission Kutla is in the aspirational block program. So
okay.
I think
So
that this will be sustained.
some funding you will get from there.
Yeah.
But also your idea is good, like using the infrastructure available and integrate various projects, the convergence of them. So SSG will come from some funding from SSG funding and all that. So that way, what
We
your
have
idea
sanctioned
is good.
40,
You
45
keep on
lakh.
refining
Yes.
it. Your idea is very good. Keep on refining it, and I think you should make a case study, put it somewhere so that others can see, and it can be replicated in other, because India has got large number of Adivasi population. So,
Yes.
this is a very targeted approach, and those artists, they are getting exposure at the district level today. Tomorrow they will go to the state level, and then you can take them up to the national level.
Yes.
So your aspiration will really be fulfilled by then. So keep on working on it. Very good. Thank you,
ma'am. Thank you.
District. So objective was to reduce IMR, MMR, reduce anemia, prevalent anemia in the especially women, and to develop service-seeking behavior among the community and sensitize community about family planning in a small family. A lot has been talked about convergence, AAA convergence. So Asha, Anganwadi worker and ANM, but how to do it on the ground and how it can be sustainable. So we have achieved, but we are trying to achieve, we have achieved some objectives through the AAA convergence. AAA stands for Asha, ANM, Anganwadi worker, and S stands for Sahika, which is functionary of W3 department, and Sathin for Women Empowerment Department. So before the these were the targets for the year 2.
Carry on.
There are some basic indicators which needs to be improved. So before 12-week registration has to improve. So we achieved 85%, 3 ANC checkup, we achieved 79%, 4 ANC or more ANC checkup, we achieved 79%. Sterilization, we achieved 44%. So I will compare data with the year 21-22. So that will show how our PUCAR has trying to achieve the objectives. So how we did convergence? Actually, we divided each revenue village or urban ward into 3 parts, and each part was handed over to Asha, Sayogini, Anganwadi worker, or Sathin and Sahika. So normally what happens, Asha looks after a revenue village, and Bikaner is largely a large geographical district spread over 30,000 square kilometers. So it is not possible Asha to run miles of the distance. So we divided villages and urban wards into 3 parts, and each part was handed over to a worker. They were given a register to register newly married couples, pregnant and lactating women, and children up to 2 years age, so that beneficiaries can be identified in advance. And those registers were checked every 15 days by ANM and signed. So whoever a new beneficiary is added to the register, information of new beneficiary is given to Asha for the follow-up, because Asha gets the incentive for the follow-up. So here we did real-time identification of the beneficiary and did follow up the beneficiary for vaccination or checkups. So philosophical components of this campaign is just community ownership, community partnership, and knowledge sharing. Here, what community we did, first we divided each revenue village in 3 portions, and we started a community meeting. So in every panchayat, every Wednesday was chosen. So every Wednesday in every panchayat in a revenue village, a meeting would be held where all prospective beneficiary will be attending a meeting at the residence of any of the beneficiary, where nearby women will be called and men also will be called to attend that meeting. So we have got 366 panchayats and 210 wards. So around every Wednesday, 500 meetings are organized at the residence of beneficiaries, where all beneficiaries from surrounding area attend those meetings. So what we do on those meetings, in those meetings, Asha read out a book containing 7 pages containing information from precautions to be taken from since conception to till their child grows up to 2-year-old. So all the government schemes about vaccination, about food habits, all are read out and discussed in those small community meetings. So around average 20 people gather in those meetings. So every Wednesday we aware around 10,000 people, especially women, adolescent girls, in those meetings. So first Wednesday we conduct a meeting in a revenue village of a panchayat. Second Wednesday we will conduct in second revenue village. Third Wednesday we will conduct those meetings in third revenue village. So we will cyclically complete all the revenue villages through the meetings. Now that cycle will once again start with same revenue village where it started, but at the different location with different beneficiary at the home of the beneficiary. So this mechanism continues and we regularly discuss. So we share the knowledge with the community and we share till it becomes institutional memory in the community. So they come forward and on the ownership of maternal child health of their community. So to develop service seeking behavior among the community. So these are philosophical aspects of these meetings. So till now we have benefited 44,393 beneficiaries and 1,46,865 pregnant women have attended PUCAR meetings, and 1,87,000 adolescent girls have attended PUCAR meetings. So we motivate them to also consume leafy vegetables so that can fight iron deficiency. So through the motivation, 30,000 kitchen gardens developed containing leafy vegetables. And though because IFA tablets are given by doctors, but a lot of women don't consume those iron folic acid but due to various reasons or social taboo, so with all the precautions, we just start the process of consumption before the community. So 1,40,000 tablets were consumed in the front of communities, so to make aware the people about anemia, iron deficiency, and to fight against increasing number of IMR and MMR. So till now we have held 26,972 meetings. So about replicability, this campaign doesn't require any extra fund, no extra manpower, and IMR, MMR reduction is required all over the region. So this was the achievement. So how up to March 22 and March 23. So our increase through the awareness, community, public movement, we were able to increase 15.45% 12 weeks before registration, 3 ANC checkup by 2.7%, 4 ANC or more checkups by 12.95%, sterilization by 6.84%, home deliveries were reduced by 482. Last year it was 642, this year 161. Hemoglobin level, because we are awareing community without any external support or funds requirement, we reduce severe anemia by 1.59%, and the women which were in category of 7.1 gram to 10.9 gram were reduced by 7.26 gram. IMR reduced by 1. Last year it was 31. This time it is 30. And MMR, last year this was 203 and this year 99. So there is a huge difference, huge achievement regarding the objectives: anemia reduction, IMR reduction, MMR reduction, without any cost, only through the public movement, public support, only through the public awareness. So these are the just numbers in form of graphs, which were I narrating earlier. So these IMR as per annual health survey 12/12/30 is was 47. Now because our March data just refreshed last day, so this was PPT prepared earlier, so we could not involve into graphics. So this was the difference between Rajasthan and Bikaner, how Bikaner improved and how Rajasthan improved from last year to this year. And we also conducted a campaign where every school-going girl, college-going girl were tested for anemia. So we tested around 2,53,000 girls, where 97,000 girls were found anemic, and their HB level was between 7 to 10. And then after we went after the treatment, gave them iron folic acid school through these schools, and finally now only 9,302 girls remain in that category which are below 10, and 84,000 girls have come out of that category. So now we are following through in a mobile application, Mission Against Anemia, my application, which follows the treatment, track them till they come out of 10 HB threshold. So these were the training, how we conducted training first for the field level functionaries, and second photo, lady is giving yellow rice for inviting to those meetings before first meetings. So these are the meetings how we conduct at the residence of beneficiary, if space is available or in some way under the tree, involving community. This is the consumption of iron folic acid in front of our team, and these are the show coverages in the newspaper. Thank you. That was all from my side. If any query is there, I'm ready to answer that.
Well, this is a very good initiative from your side, basically because you have involved the community as not only for ownership, also participation. So and you don't even require any additional manpower nor funds. I think this is very commendable job and can be replicated in other places also, because you have shown results by like improving the MMR, IMR, anemia, everything. So good luck.
Thank you, ma'am.
This is a very good project. I think you should go ahead with it, and it should be replicated at the other places also. So the only thing is, over the period of time, I think you should revisit, and you should have a feedback mechanism and some measurements to see with the areas which require improvement, or areas where additional processes have to be introduced. Well, your process setting has been excellent, but over a period of time, how you improve upon it is something which is very important, which you should look into.
Yes, sir, we'll take care of that. So it is sustainable over a long period of time.
Yes, please.
Thank you, sir. The proposal for the award in the name of Samajik Nyay Aapke Dwar. In this presentation, just I am going to narrate about how to go about saturation in these schemes. So these all schemes were run by Social Justice Department. Social Security Pension Schemes, Palanhar Yojana, which is for orphanage children and children of widow ladies, and then Chief Minister Kanyadan Yojana, in which government grants some money for the marriage of the girls of widow ladies, SC ladies from SC/ST communities and from BPL category. So schemes are run by the government. So this whole abhiyan was to do saturation. So how to get beneficiaries from the district, no beneficiaries to be left behind was the motto. So we did door-to-door survey, and we did survey of 5,10,326 houses. So in any survey, you need to do proper training of the stakeholders. So all village level workers like Anganwadi workers, Asha, Sahyogini, village development officer, Patwari, Gram Sevak, all were trained properly from district level to block level and to village level. And second, if their team is doing survey, then they should be calibrated registers to register all the information gathered from the families. And third is the challenge of correctness of survey. So if a team is doing survey, so what is the correctness of survey? So 2% of the houses were surveyed by dedicated team constituted by SDO, BDO and Tehsildar. So they verified 2% of the houses randomly. They went to the house and saw in the survey register whether all information filled by the survey team was correct or not. So this is all about saturation under this scheme. And this Panchayati Raj functionaries were involved into this. Sarpanch were written a DA letter from my side, and regularly press note all were issued in the media so that people can be aware about this scheme and the campaign to eligible beneficiary. These are the peaks of door-to-door survey, how our team went door-to-door and collected information. So this was the impact after the door-to-door survey. So all beneficiaries who were surveyed door-to-door, out of that, eligible beneficiaries were brought to the eMitra center or computer center for enrolling, because all these schemes are online. Anybody can register from anywhere. So there were considerable improvement in the numbers. Social security pension schemes. If we look at the figures of pension schemes done for single ladies, old age people, and disabled people. So overall, there was an increase of 11,585 people in the pension schemes, and there were 711 people were identified for the Kanyadan Yojana, and for Palanhar Yojana, where total 2,189 students or children were identified for being benefited into this scheme, and their Palanhar caretakers were 1,213. So this was my presentation. Nothing was new. Only new thing was how to go about saturation and the correctness of saturation. These all were the government schemes. So if there is any query, I will be able to answer. Thank you about this presentation.
See, actually, you are saying that you did a survey on 31st March and then again on 31st December. There is an increase in the numbers in all the cases, right?
Yes.
So there is only increase, or there could be a reduction also because some of them might be going out of the scheme.
Yes, ma'am. Because this is net.
So this is the
net increase, ma'am. So actually, the increase was more than that what is reported under this PPT because
that I can understand that
this is net increase, ma'am.
So this is basically the net increase.
Yes.
That is one thing that it has happened. But have you also checked whether the information itself is correct or not correct?
This is
like
online.
Adding number is one thing, but also to make sure that those who have been identified as the beneficiaries are really the should be the beneficiaries as per the norms given by the scheme or not. Has that been verified?
Ma'am, just I will brief you about the process.
So did you find any discrepancy that side?
Ma'am, because these all schemes are online, so people, any beneficiary has to come to a computer center or he can register through his mobile phone also. And then it comes to BDO in rural area and into SDO in urban area, and they check all the documents attached to the beneficiary. And these schemes are going since last 8 to 10 years, ma'am. So every functionary is well aware about these schemes and documents needed. So they collected all the information and they were knowing the norms, ma'am. All beneficiary training portion, we just refreshed them about the norms about this scheme. So whoever were found eligible in survey, all were requested to apply through online mode, and almost all people who were identified were the beneficiary of these schemes, ma'am.
Okay, fine. But what is new about this?
Ma'am, third, saturation, how to go about saturation about any scheme, door-to-door survey. Many schemes we people do door-to-door survey, and how to get correct survey, ma'am. We do survey, a lot of people do survey door-to-door, but what is the correctness of survey? So 2% verification, ma'am, was the new to our saturation process. So SDO, block level officers, SDO, BDO and Tehsildar did 2% of the families. They went randomly to any houses and just ask for the register of that village. So what information they have filled in the register, we checked that, ma'am. So this was the new in the door-to-door survey process, how to get correct information through cross-verification.
That is kind of a sample survey.
Yes, ma'am.
The 2% verification is kind of a sample survey.
Yes, ma'am.
SSO does the sample survey for years and years. So what is, I'm really not able to understand what is the new value addition.
Ma'am,
you have done a sample survey.
Yeah, ma'am. Because our village level functionaries had done survey. In private organization, ma'am, NGO do sample survey, ma'am. Government doesn't do sample survey. So if our government employees are doing survey, ma'am, what would be the correctness? We should also go about correctness. So in the government schemes, this was the sample survey, ma'am. It is not done in government schemes, implementation of these schemes, ma'am. So mandatorily 2% sample survey. So 5,000, ma'am, 5 lakhs households. 2% is still quite a good number, ma'am, by the officers itself, not some employees at the panchayat level.
Okay. But then social audit is there anyway. Otherwise,
yes, ma'am.
The schemes do have social audit.
Yes, ma'am.
That would have taken care of this.
Ma'am, if there are people who are not aware and remain in Dhanis, because Bikaner is geographically very large district, ma'am, 30,000 square kilometers spread over. So there are people, ma'am, who don't live in the village side. They live in their farm, ma'am, and they are not aware of the scheme, ma'am.
No, that's okay. But social audit, the scheme, the process of social audit is just for that, because they are the SHG group, mostly SHG group people from nearby villages or villages around. So they know those schemes. They are supposed to go and tell about those schemes, awareness creation about those schemes, and then make sure that whatever data has been filled is correct or not. That's the whole process of social
audit.
What is
the objective of your project? I'm still not confused. What is the objective? Objective is to do a survey. Objective is to bring about awareness. Objective is to have a higher coverage. What is the objective? Then we can go back on that.
Objective was to increase coverage and to 100% coverage of eligible beneficiary and to create awareness also.
What was the coverage earlier? Was it low? And how did you arrive at that?
there is no target under the schemes. Target is to cover every eligible beneficiary. So in the table which I'm showing in the PPT, it is the increase in the number of beneficiaries. And in social audit, what teams do, they audit the benefits given to the people, whether shown in the records, whether benefits are going to the people or not. This was left out beneficiaries which were not identified earlier.
Okay. See, I agree with all those things. That's a postmortem. But when you start with an objective, then there is a method to do that, and then you achieve, and then even then there will be a gap. Can you identify what is the gap right now? See, this is doing something, achieving something, and say we have achieved this thing, but you really don't know whether you are really on the target or you're far behind the target.
Sir, that will make out a point. Because, sir, there is no target under these schemes. Every eligible beneficiary has to get enrolled into these schemes, sir. So there was no.
There is always a target. So the target is your slippage percentage should not be more than X percent, maybe 2%, 3%, 5% of the eligible people may not be getting enrolled. So there is always a target that you have to bring the error less than this. If you start without a target, then I'm sorry, what you achieve is really not measurable. So to measure something, you should always have a target. Otherwise, the project outcomes are not measurable. Anyhow, thank you very much.
Thank you, sir.
Behalf of our honorable, I am here on behalf of our honorable district additional collector and my district manager, sir. As our additional collector engaged to some other important work, so I am here to represent our representation, ma'am. Ma'am, today I would like to represent how EPOS machine that works in PDS system with biometric authentication. See, we all have known that PDS, such a wonderful system, public distribution system, and biggest and huge, one of the huge welfare schemes in the world that is being carried out under NFSA Act. So in which more than 50% of the rural people and urban people and 75% of the rural people are covered. Almost 80 crores, more than 80 crores, 2/3 of the Indian population are covered under this scheme, ma'am. So in order to continue, in order to carry out such a wonderful program, this program depends on two key aspects. So one aspect is procuring food grains at regular intervals, and the other aspect is like maintaining a perfect methodology to distribute the procured stocks. So when it comes to the first point, as the Telangana state is under DCP, decentralized procurement state, so we are procuring rice stocks and maintaining right buffer stocks at district level, ma'am. So second comes the distribution part. Here so many times we comes up that there is a leakage in the PDS system. There is porous nature of this PDS system. So the poorest of the poor are not getting their rightful quantity, ma'am. So the Telangana government decided to distribute these stocks with biometric authentication, that to digital EPOS machine. Here comes the EPOS machine, electronic point of sale, that too with linkage of the individual biometric, ma'am. So in our district, we have 12 mandals of which are allocated, divided into 3 MLS points, Janagam, Ganpur and Kodakandla. So as the Telangana government chose this our Janagam district as a pilot project to implement this EPOS machine with biometric authentication, we made so much efforts to implement this scheme, this tool properly, ma'am. So for this, So for this, ma'am, in this program, the source of the procurement grains is from buffer stock, where that buffer stocks comes to the MLS point, mandal level stockist point, ma'am. So here the fair price shop dealer comes himself or herself come to the MLS point, and when such a quantity, the individual quantities that are allotted to the each fair price shop can be visible on the SCM portal, ma'am. So SCM portal is such a portal that supply chain management that we are using that platform to do all these digital transactions, ma'am. So in this digital transaction platform SCM, the ROs released order quantities of individual dealer shop can be seen on the portal of SCM. So once the dealer comes to the MLS point, and so the same quantity allotted to that particular FP shop can be pushed to the EPOS machine by his or her own authentication, biometric authentication, in which the weighing scales that we are provided at MLS points. So if there is a huge quantity that allotted to the dealer shop that we can't weigh at once on the available platform scale, there is an option to weigh multiple quantities to reach total his or her allotted quantity by multiple biometric authentications. So once the weighment is done, so the beautiful thing is like that the allotted quantity that we measure on the platform scale, meanwhile the dealer should put his fingertip, should authenticate with biometric fingertips. So then only the EPOS mission, electronic point of sale mission, will give the dispatch quantity receipt, ma'am. So then and there the individual dealer can acknowledge the same quantity, and the same can be continued till end user, where the individual dealer should also give the proper weighment and the proper quantities that can be drawn by the individual end user, sir. So for this, the only thing for this, the biggest achievement is like many times we come across the news that we are not getting a right quantity at dealer shop. So now with this, as dealer is getting right quantity against his allotted quantity from the MLS point, so he can also give it to the end user, the card holder, ma'am. So with this, as this our Janagaon district chosen as a pilot project for this implementation of EPOS biometric authentication, we did this successfully. We implemented it very successfully in the first month only, sir. So because of this, the state government now decided to implement the same to further 10 districts this time, sir, for this month. Next. Sir, this is the entire procedure, how we do our transaction on SCM and SCM, the supply chain management platform, and the EPOS, sir. So the stocks received from the mill to buffer go down. So buffer go down to the next to the MLS point. So MLS point is a mandal level stockist point, from where the stocks are transported to individual dealer shops allotted to connected to that MLS point. It carried out under stage 2 transportation. So the same allotted individual quantity can be known by his or her dealer ID. So once the dealer ID that we enter in the SCM portal, the quantities that we know, ID and password that we know, we come to know the allotted quantity. The same quantity can be pushed to the EPOS with the dealer authentication. Meanwhile, the same quantity has to be maintained, managed, weighed by the platform scale. Then only that give a permission to print out the dispatch receipt, sir. So these are the things that helped the end user. The poorest of the poor will getting the right quantity, right allotted quantity. So we can curb easily, we can curb the porous nature in entire system, and all the transactions that are made on digital. So earlier made on digital, the higher official can easily track from anywhere at any time. So how much of the quantity that has moved so far, and what are the transactions, how many transactions that are being carried out regularly, sir. So earlier, which was not possible, the higher officials used to depend on the subordinates manual report, which is a very beautiful thing that one can easily track the entire PDS system from the source to the end user, sir. That's it, sir. Thank you. These all are the portraits that how we maintain, sir. Thank you, sir. Thank you. Thank you, ma'am.
Excellent initiative. What are the outcomes that you have achieved over this period?
Yes, sir. The only outcome is that, as we discussed, many of the times people complain that we are not getting right quantity, the allotted quantity. But now this time, now onwards, there is no chance of deviation, leakage, sir. The shortfall of the quantity to draw by
Been able to achieve that. Do you have any inputs from the stakeholders like citizens about the satisfaction of the new initiatives that you have taken?
Yes, sir. So many people, individual people that appreciated our honorable additional collector, sir, implementing this EPOS mission, so that we are getting right quantity right now, sir.
Good. Excellent. Thank you.
Actually, this having the POS machines and biometric authentication at the fair price shop is something going on for a long time. I mean, many years. So what do you think? What is your UPS so that you rise above the others? Because this is nothing new in this. Neither the technology nor the system. So what is yours which is new?
Yes, ma'am. Ma'am, as you said that it is already been implemented at the fair price shops from long time, ma'am. Now we started at it MLS point, ma'am. So whenever the MLS point means where the stocks are being moved to the fair price shop, ma'am. So earlier people used to complain that as they are not getting quantity. So whenever a question posed on these dealer shops, sometimes they deviate, and sometimes they use it to say that just simply save themselves. They use it to complain at MLS point that we are not getting right quantity from there. So now there is no chance of deviation, no chance of shortfall in the quantity, ma'am.
Okay.